Good morning. Bob Ravenscroft, the Vice President for Advancement at Bryan Health. It is Monday, May 11th for today's press briefing related to COVID-19. We have Dr. Dave Miers back to address or share some insight into the behavioral health and mental health components of that. I know that there was, the last time David spoke, a lot of anxiety and so forth around being locked in. I know that we're feeling a lot of anxiety, our members of our community are, as things open back out and they don't see, some of the recommended mask wearing and so forth. So Dave's going to cover some ground on the anxiety and other behavioral health related issues as we begin to open back up today. John is here to cover what's going on inside the house and a little bit on our remote and mobile testing. Real quickly, midnight census was at 366. We have now administered 5,536 COVID-19 tests at Bryan, and as of this morning, our positives have climbed to 737, with 252 tests still pending. Just a little bit more into that, so you can see where this is coming from. Our drive-through clinic has resulted in 462 of the positives. 119 of them have been done here at Bryan Medical Center, 31 at our walk-in clinic at urgent care, and 135 from our mobile excursions down to Crete. The pendings are mostly from our drive-through. 191 of our 252 pending results are from this past weekend's drive-through activity. So again, 5,536 COVID-19 tests administered, 737 positives. After John, Dr. Miers will come up, and then we'll open it up for questions. Thanks.
Thanks, Bob. Just to talk a little bit more about the numbers, we did have a mobile last Thursday, and we saw a positive rate come back at about 19%. And quite honestly, that's good news compared to the previous mobiles that were running at about 34%. So good news from the Crete area. Did want to just share with you on those numbers some of the consistency. So from the drive-through, we have a 12.5% positive rate. From the hospital, a 12.5% positive rate. From our urgent care, about 10.5%, and from our mobile, about 30% combined. Positive patients in-house, we have 25. 6 are pending results. We have 9 individuals on ventilators that are COVID positive. 11 in our ICU, 3 in our PCU, and 17 in our general care unit. And as we mentioned before, our mobile, we'll share more information with you, but we'll probably be at 2 or 3 different sites this week as we continue to work with our health department. With that, I'm going to turn it over to David.
Good morning. Dr. Dave Miers with Mental Health Services here at Bryan Medical Center. I've been here at the Medical Center for 23 years, and today I'm going to talk to you about the behavioral health impact of COVID-19. And when I say behavioral health, that's the mental health and substance abuse combined impact of COVID-19. So as we open things up today and as things improve in our country and in our community in terms of the physical impact of COVID-19, it's important that we don't lose sight of the current and lasting impact that COVID-19 has on our mental health and our behavioral health, that it has on each of us personally as well as those around us. The Substance Abuse and Mental Health Administration, prior to COVID-19, so this is statistics from 2014, but this is relevant today in 2020, where they say 1 in 5 individuals is impacted by mental health. They also say 1 in 12 is impacted by substance use disorders. But when you look and fast forward to the current day, to COVID-19, a recent foundation poll by the Kaiser Family Foundation, they said that more than half of Americans, 56%, reported that worry or stress related to the outbreak has led to at least one negative mental health effect. Those include trouble with eating or sleeping, drinking alcohol more, frequent headaches or stomach aches, shorter tempers, and other health problems. So with the physical and financial impact of COVID-19 has and will continue to impact our mental health, and it's important that we understand those symptoms. So the symptoms of mental illness and mental health that we need to focus on: marked personality changes, persistent sadness, unexplained crying, the inability to cope with problems and daily activities, strange, grandiose ideas, panic attacks, anxieties, talking about death, suicide threats and attempts, extreme highs or lows, memory loss, confusion, disorientation, withdrawal from formerly enjoyable activities and relationships, feelings of worthlessness, hopelessness, helplessness, irritability, marked change in eating or sleeping patterns, abuse of alcohol or drugs, and excessive anger, hostility, or violent behavior. So these are symptoms of all of the mental illnesses combined. But as we move forward with things improving in our community, the anxiety is still there. So with depression and anxiety, some of the things that you may see are the trouble sleeping or sleeping more, the changes in your appetite, the irritability, the loss of concentration. But if you hear someone talking about suicide, life's not worth living anymore, it's important that you take action right away, and that you listen to that person and you ask them, do you have thoughts or do you have plans that you are going to carry out to end your life? If they do, it's important you bring them to the Bryan West Mental Health Emergency Room, which is available 24 hours a day, 7 days a week. Or call the National Suicide Helpline, which is 1-800-273-8255. The one thing that we're concerned about is that, going back to the Substance Abuse and Mental Health Administration data, is the 1 in 5 adults. What that shows, or what we know, is that those individuals, only about 1/3 of those individuals are reaching out for the help that's available in our community. That means 2/3 of those individuals are out there suffering in silence. And with the restrictions placed, on our communities, we know that folks are not coming forward for help for their mental health. And with the anxiety and the things that this pandemic has placed on individuals, we want folks to know that there is hope, there is help, and there is healing. We do have resources available here at Bryan Medical Center and in our community that can help you work through your mental health and your mental health symptoms. With COVID-19, we do feel like and know that symptoms will continue even after the pandemic improves, and that we will be here to continue to provide those resources. The Mental Health Emergency Room is available 24 hours a day, 7 days a week to help individuals determine if hospitalization is needed. We see about 6,500 individuals a year come through our Mental Health Emergency Room to determine if hospitalization is needed. We also connect with different hospitals across the community and across the state as far as individuals needing mental health services, and we do that through telemedicine services. And that helps for individuals who do not need to drive to Lincoln to come to our emergency room. So if there's individuals in Beatrice, Columbus, Crete, Neely, Tecumseh, Valentine, Wahoo, we can connect to individuals in their emergency room to our emergency room to do that emergency mental health assessment. Otherwise, individuals can drive 24 hours a day, 7 days a week to our emergency room, and we can determine the next steps. For non-emergency care, we do have the Bryan Counseling Center. We can provide in-person services through the counseling center. We also can provide telemedicine services if individuals don't want to come in person. And then we can also provide services through the Bryan Independent Center, which is our substance abuse treatment facility as well. May is Mental Health Month, And I just want to leave you with this important message, is that your mental health is just as important as your physical health. There is help, there is hope, and there is healing. It's important that you utilize the resources here at Bryan Medical Center, as well as here in our community. Mental illness is treatable, and we can help you.
11 of those are from Lancaster County. And of the 9 that are on ventilators, how many are from Lancaster County? 3 of those are from Lancaster County.
Our services have remained open since the pandemic has started, so we have continued to offer outpatient services and inpatient services. What we have done for the inpatient services is we have changed our inpatient to a single room occupancy for patient safety. So it's difficult to make any statements at this point to say whether or not our numbers have increased or decreased because of the pandemic. We have remained busy, and numbers have remained steady as far as the patients that we treat. Our numbers have continued to remain busy throughout the year with 6,500 individuals coming through the emergency room for emergency mental health care. Not all those individuals are admitted, but our inpatient services remain busy throughout the year regardless of a pandemic, but we have remained busy during the pandemic as well. Our outpatient services have remained steady as well.
The timeline as to when the peak will hit continues to extend out. I think now we're around the 16th of May. So what we're seeing is not uncommon from what we expected to occur. I still believe it's very controlled. So you're watching, even as the numbers of inpatients are going up, you're also seeing the number of individuals on ventilators go up, but it's going up in a controlled environment. It's not like you go from 8 patients on ventilators to 25 the next day. And all of that has to do with what we've been talking about, wearing the mask, social distancing, people being isolated when they find out they are positive or they're having the symptoms. Those are all what's making this be as successful as we can have it be during a pandemic. So yeah, we're watching the numbers, of course, and still continuing to take care of people. We do have the capacity to go a lot higher. We have our staff are skilled. You know, we've had the time to ramp up during this period of time, and I think we're prepared as we're ever going to be as numbers continue to climb over the next week or two.
As soon as the pandemic started, our amazing information technology department went right to work, and we were able to integrate telemedicine services right into our electronic medical record and into our MyChart accounts for individuals. So individuals can call in and request counseling services. We can set up an appointment, and a link is sent through to an individual. We help them set up a MyChart account. That appointment goes right to their email, and they click a link and they connect to the counselor right into the counselor's office, so they don't have to leave their home. And there's some paperwork that takes place before then, but it's works out really well for the individual, so we can keep that individual safe. Some individuals request that they don't want to do the telemedicine, so they come in person. But if you want to do telemedicine, we do have that available. It works out really well. We also have services through Bryan Telemedicine, where we have services where, as I mentioned earlier, that we link up to other hospitals. So we have, like for instance, we have services in Neely, Nebraska, where we provide outpatient counseling to individuals in Neely, where individuals go to the hospital in Neely and then they connect to us remotely through telemedicine through Neely.
I think our position would be, if it's going to be a busy trail where you're going to be interacting with people, where you're going to be within that 6-foot distance between them while you're exercising, yeah, it would be something that our medical staff would support if you are going to be in a remote location and you're not encountering other folks within a 6 feet radius while you're exercising. No, there would be no benefit to you or your protection of others if there aren't others around. So just use your best judgment. Don't be ashamed about wearing them if it will make you feel better. If you think you're going to get within that radius, that would be an abundance of caution for them and for you as well.